Hi everyone, thanks for joining us today. Today we're talking about something called MASLD, which is showing up more and more in kids and teens. MASLD stands for Metabolic Dysfunction-Associated Steatotic Liver Disease. You might have heard it called NAFLD before, or non-alcoholic fatty liver disease, but the name has recently changed. So what is it? MASLD is the most common chronic liver disease in kids right now. It happens when fat builds up in the liver, and you're more likely to have it if you also have other conditions like type 2 diabetes, high cholesterol, or being overweight. As mentioned, the number of kids and teens with MASLD is going up. Weight gain and obesity have a big impact on MASLD, but they're not the only causes. Many kids now eat high-calorie, processed foods and don't do enough physical activity. Of course, we understand that making healthy lifestyle choices can be hard. Fresh food can be expensive, and screens take up more time in our day than ever. Genetics can also play a part too, with some kids being more likely to have a more serious form of the disease, especially in certain ethnic groups. Compared to adults, MASLD can actually be more severe in children, with some kids getting worse faster than others, and we can't always predict who it'll be. The tricky part is that most kids don't feel sick at all. That's why finding it early is so important. Doctors now recommend screening at-risk kids, including those with obesity, starting at 10 years old. This is done by a simple blood test to check liver enzymes, which can show if the liver is inflamed. If those numbers are high, the next step is usually an ultrasound of the liver, and this is also often when kids are referred to a specialist. Now, if someone does have MASLD, how do we treat it? The main treatment is focusing on lifestyle changes, which means healthier eating and more activity. We start by cutting back on sugary drinks, and these drinks are with any added sugar known as fructose. So this is not only juice and soda, but also iced tea, lemonade, Gatorade, power drinks, and chocolate milk, to name a few. We also recommend adding more fiber and watching portion sizes, but we also want to make sure that kids don't skip meals and get all the vitamins and nutrients that they need. When it comes to physical activity, the American Academy of Pediatrics recommends moderate to vigorous activity for 60 minutes most days of the week. And we know that can sound like a lot. So starting small with fun activities that gets the heart rate up is key, and then we build up from there. And here's the good news with that. Exercise helps in MASLD even without weight loss. It brings oxygen to the liver, which can then reduce liver fat and inflammation. What we can't forget to talk about are other lifestyle habits like screen time and sleep. So it's important to get a good full 8 hours of sleep and limit the amount of time we watch TV, play video games, and surf the internet apart from doing schoolwork. Sometimes kids may also need medication on top of making these changes, but everyone is different, and whether they need medication and what kind depends on many factors like other existing conditions or genetics. But even then, lifestyle changes are always the foundation of treatment. Let's now talk about feelings. So hearing that you have a liver disease can be scary for a kid, especially when they don't feel sick. So there might be feelings of anxiety, embarrassment, or blame, and we want to keep open conversations about these feelings. Making these changes as a family is also very important. So when parents and siblings join in, for example, with cooking healthy meals together or going on walks, it shows kids that they're not alone, and that makes this journey easier. So we encourage celebrating small wins because these can lead to big changes. And we're here to help you heal your liver, one healthy habit at a time.